care, how after every before feeds how they have to hand wash and to do hand wash, that things is told to them. Even after going to toilets and what, like before touching the kids, even if the parent is going for toilet or the kids are going for toilet, how they have to hand wash. So the hand washing is most important. As far as possible, we have to case is concerned, the case usually are symptomatic treatment is there. If fever is there, we have to give antibiotics. And for the lesions, we can have some local applications, some soothing agents we can apply over there, and cases are there. If patient, sometimes if the lesions are in the mouth, then maybe in few cases the patient, the kids have to get admitted, and then treatment is done at the hospital level also. As far as we have to just see that the child is hydrated, because sometimes because of refusal of water or refusal of feeds, the child may go into dehydration. So we have to see that hydration is maintained, a good amount of ors is given, a proper ors is given. So this all things are going on as far as thing. But there is nothing to worry as far as hand, foot and mouth disease there. Our surveillance is going on, we are doing, even ic is going on. And we will see that at the local level also, at the hospital level also, at the gp level also, we have to give proper ic to the patients, and we have to treat the cases case by case. Okay, so these all things are going on. As such, nothing to worry about it, but we have to be careful because the children are involved, okay, over here. And we have to see that there are no outsurge of cases. Sporadic cases here and there will be there. One index case is there, then we have to take care that it is not passed to other kids. I urge to the parents also, if they find any kid of this particular thing, they can go to doctor, consult any hospital, private or government, go to our PSC, the doctors will tell you. As far as possible, don't send your kids to Anganwadi if they are having some viral disease, or school also. You can keep the kid at home for around 7 days, and hydrate the kids, hydrate the children. And if fever is there, then you can give paracetamol or contact the doctor. So that is going on.
So cases are increasing.
Yeah, we are getting cases from private practitioners, few cases here and there, from district hospitals also. Our pediatricians tell us that cases are there, not increasing at alarm level. Every year we have hand, foot, and mouth disease, so it is there. Maybe because COVID times, what happened, the COVID virus was overtaking all other viruses. Okay, and now the COVID cases are also down, and people are also mingling with each other. So these viruses, for example, like our simple diarrheal virus also, the cases were less, but now let's see how it is going on.
Sir,
ते
what? Sir.
हँड फूट अँड माउथ कितें डिसीज आहा आनी कितें ताका लागून प्रिकॉशन घेवंक जाय आनी कितें तेचेर
Okay. So hand, foot and mouth disease, as the name also suggests, it is hand, foot and mouth disease. कळ्ळें. So usually आम्ही पळयता की ह्या दिसांनी कितें जाता, ल्हान भुरग्याक थोडेशे लिजन्स येतात. ओके, fever with rash जाता. So usually it's a viral disease. It's a mild viral disease which has been seen mostly in pediatric age group, but sometimes it is seen in adults also. आता pediatric age group कितें जाता, भुरगे जे असतात ते usually unknowingly what they do is, like, they can, if some lesions are there on the hand, okay, unknowingly they put in mouth. Some lesions are there in the foot, unknowingly they put in mouth. So the lesions, viral lesions असतात, like sometimes you can see these lesions, they typically look like चिकन पॉक्साचे आमचे जे लिजन्स असतात, वॉटर फिल्ड लिजन्स, तसेच ते दिसपाक असता. भुरग्यांक युजली 7 days एजो कोर्स असता. युजली मातसो 1-2 दीस फिवर येता, आणि मागीर लिजन्स येता. लिजन्स टेक इट्स ओन कोर्स, आणि मागीर हळू तो 7 दिसांनी तो लिजन सुद्धा कमी जाता, क्लस्टिंग जाऊन बरे जाता. मोस्ट ऑफ द टायम इट इज व्हेरी मायल्ड केसेस, चड जायना. पण थोड्या भुरग्यांक कितें जाता, मातशे लिजन्स जे आसता ते व्हडले जाता. ओके, आणि मोस्ट इम्पॉर्टंट कितें, तेंच्या तोंडान लिजन्स येता. सो तोंडान लिजन्स येयल्या कारणान कितें जाता, दे स्टार्ट रिफ्युजींग फीड्स अँड वॉटर अँड ऑल. ओके, कारण दुखता तेन्ना. सो समटायम्स ते प्रॉब्लम जावं शकता, आणि त्याच्या खातीर मागीर डिहायड्रेशन जाता. सो डिहायड्रेशना खातीर सुद्धा प्रॉब्लम जावं शकता. वेन द लिजन्स आर स्लायटली बिगर अँड द child is slightly in a more trouble, so most of the time what we do, we admit the patient. So आम्ही त्यांना पेशंटाक ॲडमिट करता, आणि in private also it is admitted, in government setup also admitted. So we are getting the cases from North Goa and South Goa. They tell us like some lesions are there and cases are being admitted. Recently I started getting calls from private hospitals also, that they are having, suppose the lesions are very big, and then there is a concern and they call us. Okay, and cases are reported. So sometimes what happens, the lesions look very big. Okay, so that time you have to take care. Usually within 7 days बरे जाता. Fever is not much. Okay, as far as the severity of the cases are there, it is not severe. But only thing is आता घरात एक तीन चार भुरगे असतात. Okay, ती भुरगी एकमेकांक खेळतले आणि then that particular virus can just go to other kid and from that other kid. Even स्कुलांनी सुद्धा, if some kid is there and then he's playing with other kids, the possibility is that the lesions can the other child also can have. So as far as prevention and IC activities, our IC activities is going on through our RBSK doctors. What we are doing is like we are
Monkeypox in India, altogether 4 cases have been detected. So how
yeah,
is
as of now, you all must be aware that Kerala three cases are there, and in Delhi also recently, yesterday only we got one case. So our surveillance is already on. Our surveillance is already on. At the airport level, also screening is going on. As of now, the international flights are screened. Okay, any suspect case, the patient will be kept in isolation, and if any case is there, we will also send the samples to NIV Pune, and all our surveillance, everything is on top gear. So as far as possible, we will see that if because we cannot say no that case will not come only because already the case has come in Delhi, three cases are there in Kerala. But as far as Goa is concerned, we are ready for this. Our surveillance is going on.
Any connection between the hand, foot, mouth and monkeypox?
No, the virus totally, the hand foot mouth disease virus is totally different. The monkeypox virus is totally different. Okay, but sometimes the in pediatric age group, the lesions, because sometimes the lesions look similar. Okay, when monkeypox lesions look very severe, but sometimes these lesions are very small. Then in pediatric age group, it can be slightly confusing. So, but we have to investigate the case, case by case. So we just can't say that it is not there. So if any suspect is there, a proper history is there, a history of contact is there, then we will be surely sending the sample to NIV Pune and confirming the case whether it is monkeypox or something else.
so how serious is monkeypox virus?
Seriousness, as far as see, there are around more than I think around more than 12,000 or 3,000 cases all over world, and it has already been there in more than 72 countries all over the world. And there are so many cases, and around 12 deaths are there. Okay, as per my knowledge, around 12 deaths are there. But those all 12 deaths in the recent outbreak, I'm saying, those all are from African countries. Okay, so the mortality is very less. As far as cases are there, the cases are managed. So mortality is not high that way. But the WHO has already declared as an emergency. So we have to contain the case if any case comes. Prashant, suryavanshi.